Hello. This presentation will discuss the malnutrition crisis in Venezuela. Children under the age of 1 are dying from severe malnutrition due to food shortages and inflation. In 2016, 11,446 children died from malnutrition, a 30% increase in 1 year. The Venezuelan government has kept deaths from malnutrition a secret. Children under the age of 1 are mostly affected by this health issue. The Ministry of Health's 2015 annual report states the mortality rate for children under 4 weeks old has increased 100-fold. As of 2017, child mortality rate was 25.7 per 1,000 live births, an increase from 2016 at 22.2 per 1,000 live births. Children arrive at hospitals and emergency rooms the same height and weight of a newborn. They are lacking formula, which is very difficult to obtain because people can't afford it or it's scarce. Most hospitals and clinics don't have a supply of formula to give children when they come in for medical attention. Venezuela's economy is tremendously suffering. To give some background, the collapse of the economy began in 2014 and is continuing today. Venezuela had the largest proven oil reserves in the world, but when gas prices dropped, so did the country's ability to import goods. The economic crisis intensified in 2015 and 2016, with the number of severe malnutrition cases nearly tripling. Here's a description of the health problem related to the socio-ecological model. Each level is broken down to list hindering and helping factors that contribute to the health issue. At the individual level, the hindering factor is women can't afford formula and are unable to breastfeed due to illness like Zika and malnutrition. The helping factor is women are getting sterilized to prevent bearing children they cannot feed. At the interpersonal level, the hindering factor is families have to go through garbage in hopes of finding scraps of food to feed their children. The helping factor is mothers often ask neighbors of small children to breastfeed their own children. Also, young and teenage boys are leaving their homes to live on the streets, so there will be one less mouth to feed. At the organizational level, the hindering factor is hospitals are overcrowded and don't have supplies such as formula and medicine. The helping factor is doctors are keeping record and reporting cases of severe malnutrition despite their government's regulations not to report such cases. At the community level, the hindering factor is there are no community-based or local organizations providing aid to Venezuelans. The helping factor is Caritas, a Roman Catholic aid group that provides kits containing food supplements and medicine to vulnerable Venezuelan families. And lastly, at the policy level, the hindering factor is the Venezuelan government fails to address severe malnutrition as a crisis, and the president is refusing international aid. And the helping factor here is the government of the Bolivarian Republic of Venezuela distributes monthly packages of food, cash transfers, along with strengthening nutritional assessment and recuperation services. Listed here are interventions I propose that can help with the malnutrition in Venezuela. Community health workers can increase access to health care services through home visits where workers can provide outreach, referral and follow-up, as well as case management. These services will benefit women and families by minimizing their need to travel for services. Families will be educated about the importance of nutrition and given information on where they can receive assistance with food and medicine. Community health workers in the homes can provide emotional and practical support to new mothers, as well as education on topics such as breastfeeding. Federally qualified health centers will be placed in several communities, both urban and rural, serving the impoverished and underinsured, regardless of ability to pay. At these centers, Venezuelan mothers will be able to receive formula and medicine at little to no cost. Children will be able to receive preventive health services and checkups. Mothers can also receive education and demonstration on topics like breastfeeding and proper foods to feed children for nutritional benefit. Providing unconditional cash transfers to Venezuelan mothers and families can eliminate the issue of not being able to afford formula, medicine, and other necessities. Families who are considered vulnerable and high risk will be eligible to receive these cash transfers to purchase formula, medicine, diapers, food, and other essentials to secure the safety and security of the child's nutritional health. Mothers will be able to continuously receive unconditional cash transfers by following specific guidelines, such as using the funds for the above-mentioned items and taking their children for regular checkups to ensure the child is receiving the proper nutrition to help them reach their fullest potential. In order to determine if these interventions are successful, evaluations need to be conducted. To do this, we should find out the number of people who receive services from community health workers and determine if this intervention was effective using a focus group. Questions will be asked to determine if knowledge, attitudes, or behaviors have changed about accessing these services. To evaluate if federally qualified health centers are effective, I will determine the number of health centers in urban and rural areas, the number of services provided, as well as the number of providers per population to determine if this intervention had an impact on the utilization of these centers. Also, it can be helpful to record what services were used and at what frequency. Surveys can be given to Venezuelans to determine if this intervention was beneficial to their health and any opportunities for improvement. Lastly, to determine if unconditional cash transfers are successful, I will gather the number of people who received these transfers and how much money was distributed. In-depth interviews will be conducted to those who received the cash transfers to determine if it was effective and help Venezuelans purchase essential items. Potential challenges that can arise in the midst of implementing these interventions are not receiving enough funding, Venezuelans not being educated about the new services, and not enough staff for the federally qualified health centers and community health workers. Possible solutions to these challenges are accepting international funding to fund the interventions, making sure Venezuelans are educated about the services through mailing and posting flyers around the city, and passing out brochures in heavily populated areas in town. Take a moment to review my logic model. Thank you.